Welcome to Her Story of Success, a podcast featuring stories from influential women trailblazers and business leaders in hopes of inspiring you throughout your own journey of success and fulfillment. I'm Leah Glover-Hayes, your host and CEO of Her Story of Success Women's Business Collective. On today's show, I have the honor of speaking with Dr. Sophia Yen, co-founder and CEO of Pandia Health. Dr. Sophia is an incredible advocate for women, and she runs the world's only doctor-led, woman-founded, and woman-led birth control delivery company. On today's show, Dr. Sophia will talk openly about the struggles she's faced while trying to raise capital as a female founder. And we discuss the importance of pushing through the frustration to stay true to your vision. Dr. Sophia also shares helpful advice for women about reducing pill anxiety, dealing with periods, and getting more convenient and affordable birth control. I hope you enjoyed today's episode and would love for you to share it with a friend who's also passionate about women's health. So welcome, Dr. Sophia Yen.
Thank you so much for having me here today.
Absolutely. I am excited because I learned about you through SheEO, which is a group of women working on the world's to-do list. So there's activators and ventures, and activators are the investors. And so I became a SheEO activator, put the money in and got to vote on the companies that we wanted to fund. I saw yours and I immediately voted for you. I looked you up and kind of stalked you in a healthy way because I'm a fan. But I was really just impressed with your story and your company and what you're doing for women. I mean, there's so many of us that need birth control. And I think being able to have access to affordable birth control is super important. And so I'm just really excited to share your story. So why don't you go ahead and share with us, who is Pandia Health? What does it look like today? And a little bit of why do you do this?
Yeah, love it. So Pandia Health, we specifically chose the name, is the Greek goddess of healing, light, full moon. And then I also made up the definition. I think it was fate that it works both ways. Pan is every, dia is day. So we got you covered every single day. Set it and forget it. Let Pandia worry so you don't have to. And started this company, came up with the idea about 6 years ago. I was giving a talk to a bunch of physicians. Why don't those pesky women take their birth control? And one of the top reasons was we don't have time to run to the pharmacy every single month, freaking out. And I actually coined the term pill anxiety. If you imagine a pack of pills and you're getting to that last week, you start freaking out. If I don't get to the pharmacy, there will be a dire consequence. And realizing that women suffer this every single month for 20 to 40 years of our lives. And I personally have suffered this. I like to say I'm not just the CEO and co-founder, but I'm a member of the club. I live, breathe, eat, and prescribe birth control. And so my friend and I were like, well, we can solve this. We will just ship birth control and keep shipping it to women until they tell us to stop. And then when we ran ads for free birth control delivery, 60% of the women that responded to free birth control delivery didn't have prescription. As a businesswoman and as a doctor, I was like, I don't want to miss out on 60% of the customers. So
that's massive.
Yeah, that's huge. That's like running ads where it's not useful. And so we were like, we can do this. And so we came up with a different type of telemedicine. You just fill out a questionnaire, the same questions we'd ask you if you came into my office. Do you have high blood pressure? Do you have blood clots? Do you have a family history? What meds are you on? Do you like the meds that you're on? Do you want to change it? Do you want to bleed every month, every 3 months, every 6 months? Stuff like that. Then you give us a self-reported blood pressure because we need to make sure your blood pressure is okay. You can, call up your doctor's office and be like, what was my blood pressure in the past year? Or you can go visit the fire station. All the fire station are EMTs, so they can check your blood pressure too. Or a pharmacy or, other places, grocery store, you can check the blood pressure or borrow your neighbor's blood pressure cuff or something like that. And then pay us $20 once a year to have access to our expert doctors for the entire 364 days. And then our doctor looks at it. If it looks good, We write the prescription, we send it to our partner pharmacy, we bill your insurance, and we send you 1, 3, 6, 12 months at a time. It just depends what your insurance will allow. And then set and forget it, let us worry. And then every month you get this, I gotta get this right side, you get this package here. And it comes with the birth control. It comes with something delightful. So sometimes some haichu, which if you don't know is Asian starburst, is delicious. Or we partner with female-founded companies. So there's like lube, or there's a discount off of a vibrator, or other CEO companies out there. And then we also put in Pandia PSA, so a public service announcement. You see the little postcard over here. And for example, that Plan B in its generics, if your body mass index is 26 or greater, Plan B is useless. And we really want women to know that, because 60% of women in this country are overweight or obese. My BMI is 25, and given COVID, it might have hit 26, or if I eat too many carbs or too much, cake day after day during this COVID, then I could definitely hit 26. So, little health tidbits that we hope people will take a picture and share with their friends. But at Pandia Health, we're about care, convenience, confidentiality, and educating women about birth control, but also that birth control is more than just birth control, particularly in the South or more conservative states. You can use birth control not just to prevent unplanned pregnancy, but for acne. If your hormones are stable, your depression, your seizure disorder, your diabetes is better if your hormones are stable. And then most importantly, we're started a campaign to educate women, #periods optional, that if you're bleeding 1 week out of 4, you can turn that off. You can bleed every 3 months. Yeah, every 6 months, or just once a year. And how much better is life without random blood 1 week out of 4?
Wow. I just learned so much. What was it? #periods optional?
Periods optional. So if you Google Pandia Health and periods optional, or go to pandiahealth.com/periods optional, you can see my TEDx talk on the bottom on the science and safety of turning off your periods. If you turn off your periods, you actually decrease your risk of endometrial, ovarian, and colorectal cancer.
Wow.
And you also decrease your chance of anemia. The number one cause of anemia in a bleeding woman is her bleeding. If men bled 1 week out of 4, they would have learned that you could have stopped this ages ago. And we've known since 1960s that we could do this. But I think physicians were hesitant until we had enough data about the risk-benefit ratio. And now we know that the benefit outweighs the risk.
Oh my gosh. So I guess my other question would be, we talked a lot about if you have insurance, it can go through insurance. And I love that you have a little packet. You don't just get your birth control, you actually get a little goodie from another company. So you're supporting other women-led companies that are about women's health, and then providing some really incredible and very important women's health information. So what if someone doesn't have insurance? I know if you think a lot of the, musicians or people in the service industry, a lot of times they don't have health care or medical coverage with their employer. And so anything that they do is very expensive. So what does it look like if someone comes to Pandia Health and they don't have health insurance?
Yeah, so I always forget that when you go to a doctor's office and you don't have insurance, it's a blank check. It could be a $750 bill. It could be a $200 bill. It could be free if you go to a free clinic. It's just an unknown. And we as physicians oftentimes don't know what the insurance company or the hospital or the clinic that we're working at is going to bill you. We just, write our notes and we do the blah, blah, blah. We have no idea. And it's even crazier, depending on your insurance, it might have different, but if you don't have insurance. But we've taken this unknown, made it $20 once a year to use birth control expert physicians. So what differentiates us from other companies out there, we are the only women-founded, women-led, and we are the only doctor-led company. I'm the only CEO of a birth control delivery company that has taken the Hippocratic Oath. Do no harm and always look out for the patient's interest. And so our doctors proudly list our first and last name. We list where we went to school, where we got training, and most of us have like 20 plus years experience writing birth control. All that for $20 once a year. And then you get follow-up, as many follow-up questions as you want for the next 364 days. For the medications, roughly it's $15 a pack. And another radio host told me that's 50 cents a day.
Wow, that's incredible. And that, I mean, that's truly affordable. Like as a woman, I want to say thank you for developing this company and developing this program. It's such a big issue. And like you said, especially in the South or for people that work, I mean, there's a lot of ladies that will work for companies that either don't have health insurance at all or won't cover birth control. So thank you for doing what you do.
Not at all. It's just,
sure.
It's totally messed up that if your employer doesn't cover birth control under the Affordable Care Act, all insurances should cover birth control with no copay, no deductible, but there are exceptions for religious employers. And as you know, or may not know, Hobby Lobby opted out. And then there's like Jesuit colleges, which would never occur to me, like Georgetown. So it doesn't sound religious in any way, but it's Jesuit. And if you go there and you're in law school, med school, or just regular college, they don't cover birth control. So you can use birth control, not for birth control. Again, as I mentioned, you can use it for heavy periods, painful periods, polycystic ovarian syndrome, endometriosis. So if your employer won't cover birth control, they'll cover hormonal treatment for these issues. And so you can bring up that, oh my goodness, my periods are horrible. I'm missing work. I'm bleeding like stink. I'm feeling cold and tired. And that's anemia symptoms. Then they may kind of get around it that way. I also want to put out, we are the only company, I believe, that has set up a tax-deductible nonprofit Pandia Health Birth Control Fund. So if you go to our website, Pandia Health /social good, or if you look on the bottom, it says you need financial aid or whatever, you can click on it and you can apply for financial aid to use our system to get birth control delivered to your door. Or you can donate. So if you have money, you can donate and it's tax deductible. So either way.
I think that's incredible. I didn't realize that you had set that up. So that's amazing. So I think that's really powerful for those of us that are passionate about women's health and getting women access to the things that they need. I mean, that's something that I'm definitely super passionate about. So maybe that's something that, can companies donate through that? Like if it's Her Story of Success and we want to donate through my company, can I do it that way as well?
Oh,
awesome.
absolutely.
We should tell CEO that. We need to tell the CEO ladies, like, hey, you can donate through your company. So let's talk about this. So it's all great now, right? You have this company, you're rock and rolling, you're providing birth control. Talk to us a little bit about when you got started. I'm sure it wasn't like you just signed papers and started your company and we're good to go. What are some of the earlier challenges that you faced starting a healthcare company in the United States?
Yeah, so the difficulty, and I hope that, those people who vote, those people who are empowered, who have the ability to change policy, one issue that has been difficult is that we can only prescribe right now in California, Florida, Texas, and Louisiana, and we're adding other states as we get more money. And the crazy part is, as a physician, I took a test that was a national test. And I should apply my medicine skills the same, whether I'm in Louisiana, Nashville, New York, Sacramento, wherever. I don't treat patients any differently because you're in a different state,
Right.
It's the same medicine. It was the same test. But I think old school laws was that you have to get licensed in every single state. And because of that, that's a barrier for companies like me to go practice everywhere. And it's also a barrier for people I know, because I had one woman who was 26 years old, married, went to her OB-GYN, and what does a 26-year-old go to her OB-GYN for if she doesn't want to get pregnant? Birth control. And he said, honey, don't you think it's time that you had a baby? And I was like, what? And this was like, the center of, it wasn't like Boone Hickey Town. It was like, big city. And I was like, and today, this wasn't like 20 years ago. And I was like, so did you report him to the medical board or, something? She's like, no, I just walked away in shame, and women just suck it up and walk away because the doctors in power and like, oh my gosh, who am I, a woman, to ask for birth control? Like, how the heck did any of us get through college or higher education without birth control, right? And so that's why bringing a physician that's not from your community or from outside will give more women access. It will also give more women access to experts. You may have a general family practice person, but with Pandia Health, you get a clinical associate professor from Stanford. You get somebody who's gone to MIT, UCSF, and other people that've gone to other colleges that just may have the up-to-date latest and greatest. And that's why I like Pandia Health, is we're science and evidence-based, but that's just kind of one policy issue.
I love
the other issue that's been a problem is FemTech, women-run companies. When you go to your standard VC, which on average is a 70-year-old Caucasian male, and you talk about periods and you talk about birth control, they're like, la, 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 right?
Hands over their ears, yeah.
And they're like, is this really a problem? How hard is it for you women to get to the pharmacy? Why are you so lazy? Why can't you get there? And it's like, you try to get into the pharmacy every single month for 20 to 40 years of your lives. And then the insurance is evil. They only let you go during the 7 days. And if that starts on Monday, but I have time Saturday, Sunday, then you start flipping out as you get towards the end of that week, right? And so they don't understand that because they've never been there. So we as women need to be at the table. We as women, like you being a CEO activator, need to be the ones giving out the money, because you understand when a woman comes to you and says, this is a problem, you're like, yeah, this is a problem. Whereas the 70-year-old VC is like, my wife loves going to the pharmacy. She likes shopping there. She has time. She's not like the rest of us who have like 2 jobs,
might not be working.
Yeah, she's not working usually.
I mean, but even for stay-at-home moms that don't want to have more kids right now, like, I mean, you've got 3 kids on tow. Like, just because a woman doesn't work doesn't mean it's easy for her to go to the pharmacy, because that means she probably has to bring the 3 kids in tow to go to the doctor's appointment, to, so you've got to get childcare to go to a doctor's appointment, and then like tow them with you to go pick up. So I really appreciate that. So where did you get funding? So what did it look like financially when you started your company? Did you guys bootstrap? Did you find funding right away? What did that look like?
It's been really frustrating on the funding front because we've been to many women's groups and we are the 3rd to market. So there are 2 others that came before me, both run by dudes, both run by 23-year-old dude lawyers, and not by physicians, not by women. And I knew their numbers. Full disclosure, I'm an investor in both for various reasons. And so one of them got funding without ever mentioning how many customers he had. By the way, he had like 12 at the time. And bam, $1.5 million, $2 million, he got it. Then the next guy went around and he had like 45 customers at the time. Again, 1 million, 2 million. I come along, the only women-founded, women-led, the only doctor-founded, doctor-led birth control delivery company at that time, or reproductive health doctor-founded, but the only doctor-led CEO company. And I was like, well, if they did it, I could do it. I had 150 customers. And I'm sitting around begging for money. I got 500,000, but with 0 unknown customers, with 40 customers, 1.5, 2 million. And then I come along, 500,000. And luckily, not luckily, but thank goodness for young, forward-thinking venture capitalists, Precursor Ventures, amazing, invests in all B2C companies, a whole bunch of us. Charles Hudson had the vision to invest in my company and lead us off. StartX, Stanford's accelerator, invested in us and helped kick us off. And then Electus Capital, nobody's heard of them much outside of Australia or the UK, also invested in us. And then a whole bunch of angel investors, so small investors. And then most recently, CEO. And so I'm just, so thankful for all of those people that have invested and have believed in us. But it is really hard as a woman, as an older woman, as a mother of 2 children, as a physician. There's so many stigmas against us because we don't fit the 23-year-old in a hoodie look, right? And the irony is, because I'm a doctor, because I'm a mother, because I'm a woman, I'm perfect for this company. So
you're the perfect person to lead it, and you have all the credentials, and you have customers, I love that you're able to explain that. So let's go into like what can we do about it mode. Like let's pretend that the ladies watching, not pretend, there probably are, they lead VCs and they care about women's health. There's quite a few that I know of, like Backstage Capital with Arlen Hamilton. She's all about investing into women-led diversity, inclusive groups, women, African American, and LGBTQ, which she's all three. I just bought her book. I love it. There's still Sky Ventures out of New York. They focus on women's health companies. So what are, like, how else could someone listening be like, hey, I really want to push this forward because, I want this in Tennessee. How do I, someone that's passionate about it, say, what can I do to get you in my state and potentially figure out a way to get you funding?
Wonderful. So the beautiful thing is we have set up this nonprofit, and we could use nonprofit funds or foundation funds to get us into Tennessee sooner or earlier, possibly. If people have a donor advised fund, there is actually a company called Impact Assets, which is a donor advised fund, and you take some of your funds, you put it in there, and then they can invest it into Pandia Health. And so you can say, I want to invest in Pandia Health. It's unfortunately for donor advised funds, a minimum of $50,000. And then they throw on some administrative fees. But if you have, a ton of money in a donor advised fund or $53,000 in a donor advised fund, you can move it to Impact Assets and say, I want to I want to invest in Pandia Health. And if we make money, which we are and we will pay it back. And then you can take that money and redonate it somewhere else in the future. So I really like Impact Assets. The other thing is if you want to, give a grant for Tennessee people via our Pandia Health Birth Control Fund, then we can save it and only use it for women in Tennessee. And right now we are looking for investors. So if anybody wants to invest, I'd say you can do it through Impact Assets with 50,000 that we prefer 100,000. Then we can prioritize Tennessee. Because if you invest, then I will do what you asked me to do to the best and to the percentage of my ability. So the other thing is SheEO, not necessarily Pandia Health, but helping other women. If people don't know, SheEO, you donate $1,100, and then you get to help 5 new ventures, for every year that you donate that, and you get to vote on it, and you get to meet other cool women. But specifically with Pandia Health, anybody who wants to invest in is good people and won't harass the hell out of me too much, please contact us. We are definitely looking for investments at this time. And you can either invest directly if you want to write a check and sign some papers, or if you want to do it through your donor advised fund, Impact Assets is one vehicle to do that. Or if you want to just give a little bit, you can donate to the Pandia Health Birth Control Fund. And we are happy to go and prioritize whatever states that people donate or invest towards. It's just, we went for the ones with the biggest bang for buck, right? California,
absolutely.
Texas, and Florida, because it's the same effort and cost to go into a state. And so these are bigger populations. So that's why we went there. In Louisiana, we went because COVID and they had looser laws on telemedicine. So we're like, we'll go there.
And do you see that maybe changing and opening up? Have you seen any movement in that since COVID-19 happened because of so much focus on telemedicine? Do you have any hope that maybe some of these restrictions will be loosened in the coming year potentially?
Yeah, no, they've definitely been loosened right now. So right now we could go to a bunch of states really quickly, but again, there's some lawyer fees, and that's really kind of the block to get into every state. Is we have to be recognized by the Secretary of State, we have to have an entity, or we can partner with an OB-GYN office. So if you know an OB-GYN or family practice or internal medicine, or even technically a dermatology office, any office doctor that wants to partner with us, then we could get there faster. So that is a different way to go into, and we may be looking at that model, and we've actually done that for Texas. So for Texas, we found 2 private practices, and we're going through them, and we could do the same for Tennessee or any other state that's out there. That's another way to get into another state faster. So if you have a physician friend that is willing to open their practice up to us to send physicians through there, And then, of course, if there's physicians that want to work for us, we are flexible because of our system. It's online, it's 24/7. So if you're like a night owl like me, you can do it from midnight to 3 a.m. Or if you're working an ER shift and you have an extra hour, you can work that time. Or if you're on maternity leave while you're breastfeeding, it's very flexible.
That's awesome. I love that you're giving options to women to work for you or to partner with. One of the things I love is, sharing stories and amplifying messages and saying like, this is something that I think is important and I want to share it. It's anybody that's on social media. Like if you repost anything, it's all about like, oh, I thought this meme was funny, so I'm going to share it. What I would love to see is more of us women doing that for more women-led companies, women founded things. That's something that we're really passionate about with Her Story of Success is saying, hey, who are the companies out there that are doing something great that we want to recognize and introduce more women to, right? I found out about you and was like, oh my gosh, I want to share you with the world. A few of the other, obviously, CEO companies are the same way because change can happen. And it happens when one person like you starts it, and then a couple other people that are on your team got excited and they're like, yeah, why would we not do this? This is amazing. And I know for any other female founders listening, it can be really frustrating when you get started and you're like, this idea is amazing and it's going to change the world. And like, why is this trudging along? So like, I feel like I'm just wading in mud, right? Do you ever feel like that? You're just like, this is a great idea. Why is like not everyone caught on to this? But to give you some encouragement, sometimes that does happen. And sometimes there's things that we have to figure out along the way so that when the floodgates open, we have the foundation for ourselves as a founder, as a person, and also our company to be able to move forward, right? And to be able to handle like, okay, what if 50 states open tomorrow? Like, does Pandia Health, are you able to do that? Do you have enough people in place? So I think CEO Vicky Saunders that started that, she talked about that, right? She expected like $1 billion fund in a couple of years and it didn't happen. But what's been so incredible is to watch her build something that is so solid, because she said, businesses grow at the speed of trust. So I'm excited to be a part of this trust building for you as you grow forward. But I just think that like it's going to happen. You're going to be in all 50 states. We, the Her Story of Success community, is going to make that happen because it's right and it's good and it's about providing good things. So I've appreciated you and appreciated your time. I only have a couple more questions because I'm like, now wanting to get busy on getting you into all these states. But would you share with us just where people can find you? Are you on the socials and your the websites and all that stuff? And then the second question I'm going to give you a minute to think about as you're sharing is, what does success look like for you in this season? Like today, because I know this pandemic has been hard on everybody. So I just really want to understand, like, when you think about being successful, what does that mean or look like to you today? But share with us where we can find you first.
So yes, please check out Pandia Health. We are on Twitter, Instagram, Facebook, LinkedIn, YouTube. We have amazing educational videos. If you have any question about the birth control pill, patch, or ring, all over YouTube, we have lots of answers, but you can always hit us up on Facebook, Instagram, Twitter, and we'll answer your questions about that, and also about #periods optional. What I forgot to mention is we can deliver to all 50 states. So if you already have a prescription and you're like, I don't have time to go, just tell us where it's at, give us your insurance info, or if you don't, you can pay with a credit card for the medication, and we just move it from your pharmacy to our partner pharmacy, and we don't charge you anything. Our free delivery, automatic refill, and you get these goodies over here. All that's free if you got insurance to cover the meds. And if you don't, then it's $15 a pack for most medications if you're okay with generic and you aren't on some really weird medication. And so anybody in all 50 states can use this for the free delivery.
Okay.
But if you need the doctor component, then unfortunately only California, Florida, Texas, and Louisiana for now, but we are going to get creative. We're going to hook up with more private offices and get out to more states. You've reminded me and inspired me to go do that. And what other places can you find us? You can also find me personally on Twitter and LinkedIn, not on Facebook. That's more personal. I'm Teen MD, so I'm adolescent medicine specialist. And so that's why it's teen, as in teenager MD. And it's more political, so it doesn't reflect the company or other stuff like that. And then what does success look like for me in today's world? I think the big success, Pandia Health, our plan is we start with women with birth control, but we grow with them as they grow. And so all my friends want me to do menopause and wrinkle cream. So we may be launching that very soon because it's a real issue for me and my friends. Also, acne is very easy to add on, and birth control is good for acne, but for acne, all I need is a picture of your face, your chest, your back. You tell me what you're on. I can write you some really good stuff if you have insurance. If you don't have insurance, it's still really inexpensive. The oral antibiotics, the topical antibiotics, but the tretinoin cream, which is magic for both wrinkles and acne, is a little pricier, but still cheaper than some of the stuff you might buy over the counter. And in terms of success, Pandia Health is here to make women's lives better. We will absolutely make money for our investors, but we will not do it by pushing second-rate medication, second-rate care. And people need to look out when you're doing telemedicine. If it's your regular doctor, go ahead. But if you're looking between two different companies, please choose the one that's female-founded, female-led, doctor-founded, doctor-led, and the one that's going to look out for you. You want to make sure you know who the doctors are. You want to make sure you know where they went to school, what their training is. Was it a dermatologist that founded a birth control company? Was it a lawyer dude that founded a birth control company? Or, you know what I mean? Look at what their interest is, because I can say that not everyone has the same scientific and medical background that I do. And some people will practice things that I would never do and that I would not recommend.
Because you've taken the Hippocratic Oath.
Yes,
that's important.
I've taken the oath to do no harm, and because I care.
Awesome. Well, thank you so much. I'm more inspired by you every time I talk to you. So thank you, Dr. Sophia Yen. We appreciate you and hope that you get in all 50 states very, very soon. So thanks and have a great day.
Thank you so much for having me.
Thanks for joining me. To subscribe, click the circular icon, and to watch the latest episode, click the video on the right. If you listen to podcasts, check out Her Story of Success on your favorite podcast platform. See you next time.